Hi, welcome back to my channel. My name is Jelly Franklin. I'm a student nurse. For today's video, I'm going to demonstrate to you how to give or how to provide perineal care and urinary catheter insertion. Let's start off with perineal care. Perineal care is a procedure that involves a thorough cleansing of our client's external genitalia and the surrounding skin. There are two purposes of this procedure. First is to remove the normal perineal secretions and odor, and the second one is to provide client comfort. The materials that we will be using in this procedure are the following. We need our bath blanket, protective pad, washcloth, bedpan, pitcher of water. We also need our pickup forceps with jar. Assessment. In assessment phase, there are 5 things we have to remember. First is we have to assess the client's mobility and activity tolerance. This is for us to find out if the patient will be able to participate in the self-care. Doing as much self-care as possible is very important because it will promote a sense of independence and it will maintain modesty. Second, we have to assess for positioning or activity restrictions such as maintaining hip abduction following a total hip replacement. This is to avoid injuring our patient during the procedure. Third, we have to assess for any psychosocial issues that may be of concern to our patient regarding perineal care. Culture is very important to consider when giving perineal care because for us to find out if it is appropriate for that patient. In some cultures, it is very inappropriate for a male nurse to give a female client the perineal care. Next, we have to assess for our client's specific need for perineal care. For some lesions and skin breakdown, we may have to use a special lotion or soap. While for drainage and incontinence, it requires assessment and follow-up to avoid impaired skin integrity. And lastly, we have to assess for the presence of a urinary catheter, perineal surgery, or lesions, since we may have to adopt to the procedure in order to clean around an indwelling catheter or incisions. Planning. In planning phase, there are 2 things we need to remember. First is we can assemble our equipment that we will be needing for this procedure. Having all your equipment prepared in advance will facilitate accomplishment of tasks and it will save you time. Last, we have to plan for necessary assistance. Let's dive into implementation. In the implementation phase, first, we have to identify our patient. Identifying your patient and explaining to the patient what you will do, why it is necessary, is very important to know that you are doing the procedure to the correct patient and to alleviate the patient's anxiety. So this is how we will be doing it. Good morning, ma'am. My name is Jelly. I will be your nurse for today. May I know your complete name and your birth date? Angelina Jolie, born on December 13, 1993. May I check your wristband? Alright, thank you. Miss Angelina, today your doctor has ordered to give you a perineal care in order for a preparation for your urinary catheterization later and to avoid causing an unnecessary infection. In this procedure, I will make sure that I will provide the necessary privacy so you would feel secure and safe. Do you have any questions regarding the procedure? Okay. After identifying the patient, explaining to the patient what you will be doing and how the patient can cooperate or why is the procedure necessary, we also have to note any embarrassment that the patient might feel so we can provide additional comfort to the patient. Then, we have to provide privacy by drawing the curtains around the room or closing the door to the room. This will lessen the patient's anxiety. Now, after that, we have to make sure to adjust our room temperature and also assist our patient with elimination needs. Assisting our patient with the elimination need is so crucial. That way, there will be no unnecessary interruptions during the procedure. Thus, it will allow us to clean thoroughly the area or the perineal area of our patient. Meanwhile, adjusting the room temperature will avoid chilling the patient during the procedure. After that, we may now wash our hands and wear clean gloves. Now that we have washed our hands properly and wear clean gloves, the next thing to do is to raise the bed to a comfortable or to a working height, and of course lower the side rail nearest us. This will prevent injuring the patient or experiencing fall injury to the patient during the procedure, and raising the bed to a higher working height will let the nurse to work with ease and avoid back pain during the procedure. Next is to place the patient on a back-lying position or the supine position, and we could now insert our protective pad and as well as our commode, especially if the perineal area is grossly soiled. The bedpan right here or commode will allow us to use additional water for thorough cleansing, and it raises the hip of our patient. This will give us a good visualization of the area for thorough cleansing. Miss Angelina, I'm going to insert the waterproof pad under you, okay? Alright. There you have it. And I'm also going to insert the commode for thorough cleansing later on. There you have it. Next to that is we may now drape our patient for privacy. Now, for female, there are 5 things we have to remember in draping our patient. First is we could use the diamond style or the diamond technique of draping our patient, wherein one point of the diamond will be facing towards the client's head, and then the other point of the diamond will be wrapped around our patient's leg and tucked under the foot, and repeat on the other side. Then we may fold the center lower point of the diamond to expose the perineal area only. This draping technique provides as much privacy as possible and covers as much skin there is, and the patient could rest on the blanket. Miss Angelina, I'm going to drape you with the bath blanket right now. Now there you have it. Our female patient Angelina Jolie is now draped properly. For male, there are only 2 things we have to remember. We have to drape our patient using the diamond technique, still starting from the chest all the way down and folding it, exposing the groin area only. After the draping process, the next thing to do is to remove any fecal material using the toilet paper. Removal of the fecal material will prevent the fecal contamination of the perineum area, which can cause bladder, vaginal, and incisional infection. In the removal of fecal material, we have to remember to wipe it from front to back in order to avoid contamination. The next thing to do is to dip the cotton balls in warm soapy water solution. So for female clients, we have to use long and gentle strokes starting from the symphysis pubis all the way to the rectal area and observing the rule of 7. This will prevent contaminating the urethra with any fecal material, since any fecal material that will be left on the skin can cause breakdown, and also it can cause urinary tract infection because of the presence of E. coli in the anal area. So for rule of 7, the very first thing is we have to start from the symphysis pubis. Okay, we have to start right here all the way up, then discard. Next is wiping the area that's far away from us, that's from the inguinal area, going up to the legs. And then repeat on the side that's near to us. Next is wipe the labia majora that's far from you, top to bottom, like you're drawing number 7. And then wipe the labia majora that's near to you from the mons pubis all the way down, discard. And then wipe the labia minora, discard. And lastly is to wipe the center portion from top to bottom, from the urethra all the way down to the anal area. So there you have it. That's a rule of 7. So always remember, we have to start from area that is far away from us and the one that's near us. That's to avoid contamination. For our male clients, we have to remember to retract the skin or the foreskin of the penis if uncircumcised. Then we have to clean it using circular motion from inside to outside. Replace back the foreskin and thoroughly cleanse the shaft of the patient, including the scrotum. The scrotum, we have to handle it with care because it is very sensitive. Retracting the foreskin of the penis will actually allow thorough cleansing of the head of the penis, and replacing back the foreskin will prevent the edema of the penis. Using long and gentle strokes when wiping or cleansing the patient's shaft is necessary to avoid erection. In both male and female, we have to cleanse the skin folds thoroughly of the groin area. Also, we have to pat it dry and examine for redness or excoriation. Detecting and preventing excoriation is so important because that is where the moisture would accumulate. Then, the next step is to rinse and pat it dry. That is to prevent injury secondary to maceration. So in using the hand mitt, basically you could use first the front portion, the back portion, and the other side portion. After patting the area dry, the next thing to do is to turn the patient on one side, separate the buttocks, and clean the anal area, giving special attention to the rectal area. The fecal contamination of the perineum area can lead to skin irritation and urinary tract infection. Therefore, the anal area must be cleansed last. Miss Angelina, I'm going to turn you to one side, okay? Miss Angelina, I'm going to turn you to one side. So in cleaning the anal area, you could either do 2 different ways. You could start from the perineum area all the way back, or from the lower back all the way down, but we need to be careful not to contaminate the perineal area with any fecal material, otherwise it can cause infection. After cleaning the posterior region of our patient, we may now remove our gloves and massage our patient's bony prominences, okay? Because that will prevent the decubitus ulcer and it will promote good circulation. The decubitus ulcer is very common among the bony prominences of our body, such as the heels, the hip, the sacrum, and the shoulder. So let's remove our gloves and massage, apply effleurage on our patient's bony prominences. After the massage, do aftercare. Change the linen that got damp during the procedure because this will provide patient comfort, privacy, and safety. Put the blanket back. And there you have it. For the evaluation, we have to assess our client's response. We also have to note any difficulty of our patient of motion or the range of motion during the procedure. And lastly, we have to note the skin color for possible redness or any other abnormal findings. For the documentation, we have the chart on the nurse's notes, the perineal care given, the patient's response during the procedure, and the condition of the perineal area. And that would be all. Thank you.